Welcome to This Week in Fitness by ATFW, where we crunch the latest fitness business headlines all in under 5 minutes. I'm your host, Chrissy Van, and here's what's making news. Novo Nordisk has ended its relationship with Hims & Hers Health, alleging the telehealth provider promoted and sold compounded versions of Wegovy in ways that could pose patient safety risks. The company says Hims & Hers will no longer have access to Wegovy through its NovoCare pharmacy platform. According to Novo Nordisk, Hims & Hers promoted mass-produced compounded semaglutide products under what it described as a false guise of personalization. Dave Moore, Executive Vice President of U.S. Operations, stated, "When patients are prescribed semaglutide treatments, they're entitled to receive authentic FDA-approved and regulated Wegovy. We'll continue to take action when companies engage in illegal sham compounding that jeopardizes the health of Americans." The FDA has previously warned about the safety risks of compounded semaglutide, particularly those containing salt-based variants not used in the approved drug. Hims & Hers has not issued a public response at the time of recording. Next, the American College of Cardiology has released new clinical guidance that may shift how the fitness industry interacts with clients managing obesity. The update recommends GLP-1 medications like semaglutide and tirzepatide earlier in treatment, regardless of whether patients have tried lifestyle changes. Obesity affects more than 40% of U.S. adults and is linked to increased cardiovascular risks. Clinical trials show these medications lead to 15 to 21% average weight loss and reductions in stroke and heart attack risk. For fitness operators, this signals a growing need to integrate strength training and sustained engagement strategies that align with medical treatment plans. Some brands are already adapting. Lifetime has introduced medically integrated programs, and Weight Watchers and F45 are building hybrid care models. Staff education around these medications may become increasingly important, especially as access expands. Meanwhile, a new mental health partnership is pushing the boundaries of wellness and fitness environments. Starting July 1st, Solace New York will offer free confidential mental health services on site through a collaboration with nonprofit Solace House. Dr. Nandini M. Collins, CEO of Solace House, explained the approach. This is about meeting people where they are, not just physically, but emotionally. The virtual counseling services aim to reduce barriers to care and normalize mental wellness as part of the gym experience. Solace New York CEO Brian Bullock added, "Mental wellness matters just as much as physical strength." The model may prompt others in the industry to explore more holistic approaches to member care. Turning to policy news, fitness operators are watching closely as Congress finalizes its tax reconciliation package. At issue is whether health savings account funds can be used for fitness memberships, classes, and youth sports. The current Senate draft excludes the FIT Act provision, but advocacy efforts are underway to reinstate it. The Health and Fitness Association is calling on clubs to mobilize members and staff by sharing a pre-written letter to Congress. Mike Gazinski, Vice President of Government Affairs at HFA, emphasized that the window for influence remains open and urged direct engagement from the industry. If passed, the change would allow up to $500 per person or $1,000 per household in pre-tax HSA dollars to go toward physical activity. Proponents argue this could support preventative health and increase access to fitness services. In brand growth news, Pvolve has landed a spot on Entrepreneur Magazine's Franchise 500 list, its first appearance on the ranking. The company placed number 78 in the top new and emerging franchises category, a nod to its continued expansion. With more than 20 studios and 50-plus locations in development, Pvolve combines studio fitness with a digital on-demand platform. President Julie Cartwright said, "This milestone reflects the strength of our brand, the dedication of our franchise partners and team members, and the growing demand for innovative, science-led fitness across the country." Celebrity partnerships and national campaigns have contributed to its visibility. As it scales, Pvolve joins a growing list of boutique concepts expanding their footprint through franchising. And finally, Zumba is bringing back one of its most popular community events. After a 7-year hiatus, the Zumba Cruise will return in March 2026 aboard the Norwegian Pearl. The 5-day event departs from Miami with a nonstop in Cozumel, Mexico. The cruise will feature daily workouts, including classes from Zumba creator Beto Perez, along with Strong Nation, Circle Mobility, and nightly themed parties. The revival taps into Zumba's global community and brand loyalty while blending travel, fitness, and entertainment into a single immersive experience. That's it for This Week in Fitness by ATFW. I'm your host, Chrissy Van, and remember, stay fit, stay informed, and keep your fitness business in shape.